Hello, welcome to this presentation on the coronavirus. My name is Joanne Boudreau, and I'm a registered nurse who works with the occupational health team within the Direction de Santé Publique of the CIUS de l'Estrichue. Today, our topic is the coronavirus, COVID-19, its symptoms and how it is transmitted. We will also look at the interventions that are being done by the Direction de Santé Publique and look at the preventive measures that are required in the workplace, and finally do an overview of the psychological and social aspects of the disease and how we can cope or deal with them. The virus that causes the coronavirus disease, COVID-19, is a new virus. The first cases were documented in China in December of 2019. The virus enters the body through the eyes, nose, and mouth. It can stay alive on copper for 4 hours, on cardboard for 24 hours, on plastic or stainless steel between 2 to 3 days, and on damp or humid surfaces for up to 6 days. The direct transmission of the virus is mainly by droplets. This means when a person who's infected by the virus coughs, sneezes, or spits, the virus that is contained in the droplets are spread into the air where they can be received by a person who will inhale the droplets or get the droplets in his or her eyes and therefore become infected with the virus and develop symptoms. Another way to catch this virus is by touching objects that have been previously contaminated by an infected person's droplets. For example, by shaking hands with someone who has the virus on his or her hands and then bringing your hand to your face, allowing and touching your nose, eyes, or mouth, allowing the virus to get into your system. Another way is by touching doorknobs or any other object that has previously been contaminated by an infected person's droplets and then bringing the virus on your hands to your mouth, nose, or eyes. This is called indirect transmission. Now, the incubation period is a time between day 0, when a person who is healthy comes in contact with a virus, and the time it takes for him or her to develop symptoms, which is usually between up to 14 days. The contagious period is the time when a person can transmit the virus to others. So the person is infected or contagious. What is particular about this is the person can be contagious even before he or she has symptoms. So it's up to 48 hours before the symptoms are apparent. And then this person can be contagious up to 14 days after the beginning or the onset of symptoms. This is why it is so important to do self-monitoring of symptoms or self-assessment of symptoms. Every day before leaving home or going to the workplace, a person should ask himself or herself, do I have a fever? Do I have a cough? Do I have difficulty breathing? Do I have a sudden loss of smell with or without loss of taste? If the answer is yes to one of these 4 questions, do not go to work. Call your employer and inform him or her about your symptoms. There are other symptoms that we have to be out on the lookout for also. They are general discomfort, which include fatigue, muscle pain, or soreness for no obvious reason, unusual headache or loss of appetite. The second symptom is diarrhea in the last 12 hours. And the third symptom is a sore throat with no obvious cause. If a person has at least 2 of these 3 symptoms that are in the second frame, it is reason to not go to work, to again call your employer, let them know about your symptoms, and we strongly recommend that you get tested. So if you have at least 1 symptom in the first frame or at least 2 of the 3 symptoms in the second frame, it is recommended to get tested for the coronavirus disease. One of the more usual complications of the coronavirus disease is severe pneumonia. The symptoms are difficulty breathing, which is a shortness of breath or a rapid respiratory rate, chest pain when you inspire, sustained fever, or a severe cough with phlegm or mucus. There's actually no specific treatment for the coronavirus, nor is there a vaccine to prevent it. The treatment is based on the symptoms that each person has. There is, although, ongoing research projects in Quebec and elsewhere in the world to find a treatment and a vaccine. It is important to know that most people who get COVID-19 will recover on their own. They will probably be sick for quite a few days, but most people do get better on their own. Now a few words about the actions that are being done by the public health agency, or the Direction de Santé Publique. When a positive test result comes in, it is sent to the Direction de Santé Publique. They begin an investigation by calling the person with a positive result. This person is called a confirmed case, and they do an assessment on the person's state of health. They ask them when the symptoms started, the contagious period, and they give guidelines to this person. They also inquire about all the people or persons this confirmed case has been in contact with. And so we call these persons the contacts of the confirmed case, and they call them as well and do the same assessment. All this is done to avoid the spreading of the coronavirus disease. Now, how do we be called a contact of a confirmed case in the workplace? It is a person who's had a prolonged contact, which means at least 15 minutes at less than 2 meters with a confirmed case without applying the recommended measures, which are wearing a mask and eye protection. This also includes exposure that has been taken place during transportation by carpooling or in a bus. The person who is considered a contact of a confirmed case is also removed from the workplace for 14 days by the public health agency. It's important to know that lifting of isolation measures is always done by the Direction de Santé Publique. This means if you are at home and you have not yet been contacted by the Direction de Santé Publique, it is important to continue applying the appropriate measures to prevent spreading of the coronavirus disease. Now we'll talk about the preventive measures in the workplace. As you may already know, the most important way to prevent spreading of the COVID-19 is by washing our hands with soap and water or with antiseptic gels. It is important to wash our hands more often than we usually do. We already should be washing our hands after coughing or sneezing or blowing our nose, after using the bathroom. But now it's even important to wash our hands after being in public areas, public transportation, when we come back from doing groceries. A good hand washing with soap and water is required. There are many posters or websites that describe the best way, the ideal way to wash hands. It's by using soap, of course, and by washing our hands for at least 20 seconds. And it's important to not touch the faucets after washing our hands, but by using the paper towel to close the faucets, and therefore to not contaminate our hands after we've just washed them. It is important to use antiseptic gels when the soap and water is not available. Another important measure is respiratory etiquette or respiratory hygiene. If you have to sneeze or cough, it's important to cover your nose and mouth with a tissue and to dispose of it after. Or if you don't have a tissue, even the best way is to turn your face into your shoulder or the bend of your elbow to sneeze or cough. And this way you avoid the projection of droplets into the air. Other measures that are important to respect during this time of epidemic is to not share food, beverages, or cigarettes, to wash your hands before eating, drinking, or smoking, to always wash your fruits and vegetables before eating them, and not share containers of ketchup or mayonnaise or salt and pepper shakers, and to prevent your personal belongings from coming into contact with those of others. Some actions that should be taken by the employers are to encourage working from home or teleworking when it's possible, by applying hygiene measures in the workplace and social distancing principles also. Examples of preventive measures concerning hygiene is disinfecting each person's workstation before starting work and at other times during the day, maybe before or after breaks or meals or start or at the end of shifts. You may disinfect your tools and equipment using your regular cleaning products. What's important is to do it more thoroughly and more frequently during the day. It's important also to keep all the shared areas disinfected frequently. By shared areas, we may mean the lunchroom or the washrooms. And it's also important to disinfect the high-touch objects, such as light switches, doorknobs, the refrigerator door, countertops or tabletops, anything that is shared by others or highly touched by others. You can even keep a cleaning registry of your cleaning that includes where, when, and by whom. It's important to also have a work attendance policy for COVID-19 signs and symptoms. This is what we talked about at the beginning of the presentation. Make sure that workers assess or monitor their symptoms every day before entering the workplace, and that they warn the employer and refrain from going into work if they have any symptoms. It's the same thing if you develop symptoms during the course of a working day. The worker should be isolated in a room, be asked to put on a mask, and we should ask the worker to go home. A proven way to avoid spreading of the disease in the workplace is by promoting physical distancing measures or social distancing measures. That means that every worker should stay at least 2 meters away from other workers at all times during the working day. It also means that we have to prohibit non-essential face-to-face meetings and gatherings. We should adjust meal times and breaks so there are less people in the lunchroom at the same time. And everyone should refrain from shaking hands and hugging when greeting each other. Remember to keep a distance of 2 meters between each other at all times. When physical distancing is impossible, these are some measures that we should have in the workplace. Each worker should keep the same workstation, location, and equipment. They should avoid sharing tools. It might mean we have to cut back on production and install physical separations like solid partitions or plexiglass. And every worker must wear a procedure mask and eye protection. A few words about carpooling. It should be avoided as much as possible. We should, if it is inevitable, there shouldn't be more than one other person besides the driver in the car. This other person should sit in the back seat opposite the driver. Both should wear a mask and wash their hands before entering the automobile and before leaving it. And high-touch surfaces such as door handles or steering wheel or the sides of the door should be disinfected. Remember, if one person in the carpool who carpools gets infected, the other person will be removed from work for 14 days also. Now a few words on first response and first aid during the COVID-19 pandemic. The personal protection equipment to be worn, in addition to gloves, by the first aid worker and the rescued worker are minimally a procedure mask and protective eyewear, such as goggles or a visor. Other recommendations from the INSPQ are available on their website. Now I will demonstrate for you how to put on a surgical mask. So you wash your hands thoroughly before with soap and water. Then you grab the mask by the elastics, bring it to cover your nose and mouth, and wrap it around your ears. Then you bend the mask so it molds your nose, and you bring the mask under your chin. It should fit snug. While you wear your mask, it's important to not touch it with your hands. If you do, wash your hands immediately after. Do not pull down on your mask to talk or to eat. Leave your mask in place while you need to wear it. When it's time to take it off, grab the elastics again, bring the mask away from your face and dispose of it, and wash your hands again thoroughly with soap and water. Now for the more psychological and social aspects of the coronavirus disease. As we all know, the arrival of this tiny little virus has had a major impact on all of us. May it be by getting sick or having a loved one getting sick, by being away from work or out of school, by being asked to wear masks, to keep our distances, by waiting in line at grocery stores or hardware stores. All these measures have changed our habits and our lifestyle. So it is normal to be feeling or to experience fear of the disease, financial issues, family-related overload, decreased social contacts, quarantine. All these aspects or factors can cause stress, anxiety, or depression. So some of the possible reactions to these stressful aspects can be physical reactions such as headaches, difficulty sleeping, decreased appetite, or fatigue. Others are more psychological, such as ruminating, or feeling irritable or confused, or even suicidal. And then others are more behavior related, such as increased use of medication, drugs, and alcohol. If you have some of these reactions and feel that you need help, there is a social hotline that you can call by dialing 811. There you can talk with a social worker or counselor who will give you some help on how to deal with these possible reactions. Do not hesitate to call this hotline. During this crisis, it's important to take care of yourself by maintaining a healthy lifestyle, which means eating well, sleeping well, exercising regularly, by keeping in touch with people who make you feel good, by texting, Skyping, FaceTime, a phone call. And it's good to limit the time spent on COVID-19 research. And if you do, only consult reliable sources. Remember, take some quality time for yourself. For more information on the coronavirus, here is a reliable website that you can contact. The website is www.santéestrie.qc.ca/en/home/. If you develop symptoms, there is a toll-free number that you can call, which is 1-877-644-4545. For other reliable sources that are more work-related, there is the IRSST, which is the Robert Sauvé Research Center. There is the INSPQ, which is the Public Health Expertise and Reference Center. And there is also the CNESST. There is also a hotline that is available for workers and employers in the Eastern Townships. The number is a toll-free number also, 1-844 829-9772, option 0. There is a person there who can answer the questions that you may have about prevention in the workplace. This concludes my presentation on the coronavirus. I hope the information will be useful. Please remember to be on the lookout for symptoms and to take care of yourself and your loved ones. Thank you for listening.